What is a biopsy? A biopsy is the removal of a piece of tissue or organ with the aim of examining it. When a lesion is seen through medical imaging, a biopsy is often performed, usually by a radiologist. Further examination of the removed piece of tissue by the pathologist allows for a diagnosis to be made, confirmed, or ruled out. For example, if a mass is seen on imaging, the biopsy will show whether the cells of the mass are malignant and whether or not it is cancer. If it is indeed cancer, the biopsy can also help in determining the right treatment. Specific properties of the cancer cells can thus be examined and, for example, indicate whether or not a patient qualifies for a particular therapy. The biopsy is performed in hospital under local or general anesthesia, depending on the organ to be biopsied. The duration of your hospital stay after a biopsy depends on the anesthetic and the organ being biopsied. It can vary from 1 to several hours. Your doctor will make arrangements with you before taking the biopsy as to whether or not you should take certain medication, for example, blood thinners. This is necessary because there is a small chance of about 1% of bleeding after a biopsy. Therefore, after the biopsy has been completed, you will remain under observation in hospital for some time. It is also recommended that you ask someone to accompany you to the hospital for your biopsy. It may take up to several weeks before the full results are available, as the preparation and analysis of the tissue samples takes time. Recently, liquid biopsy has also been adopted to better fight cancer. When a tumor is present in the body, tumor cells may detach and enter the bloodstream. The same applies for pieces of genetic material derived from tumor cells. These contain a large amount of information that can be accessed through a simple blood test. Liquid biopsies have the advantage that they are less invasive for the patient, but they do not completely replace conventional biopsies, which provide additional information about the tumor environment, among others. As such, the two techniques are complementary. If you have any other questions about this topic, do not hesitate to get in touch with your healthcare providers at the hospital.